Hi my loves, welcome back to my channel. If this is your first time seeing my face, my name is Sydney. I'm a perinatal athletic therapist and postnatal fitness specialist. I'm currently 32 weeks pregnant and I want to talk to you guys today about my birth preferences, birth plan, birth wishes, whatever you would like to refer to them as. I have some very specific things that I want or don't want, but there's also a lot of things that I'm just like, whatever needs to happen can happen, if you know what I mean. Please don't mind my voice. I'm getting over this ridiculous cold that has made me so congested. So I sound a little funny, but whatever. Here we are. I also stopped and grabbed myself a latte from Starbucks because it is gross outside. Like, it's rainy. It's 14 degrees, which is not terribly cold, but like it's the end of May. Like June starts in a couple days and it's gross outside. It hasn't been nice like the whole time. So we're just going with a fun little latte today. Or la-ti-da, as my husband calls it. So this is my Starbucks latte order. I get a grande almond milk latte with cinnamon steamed in, decaf, and 3 pumps of hazelnut. And it's kind of like fall in a cup. And I love it. I love it so much. I think it's still way too hot to drink, but whatever, we'll hold it. We'll hold it because it'll make me feel cozy. Okay, a couple things I'd like to say about birth plans before we get started. The first thing is, these are my birth preferences. If you don't agree with them or if you have different ones, that's up to you. I don't really care. These are things that I want, that I've talked with my practitioners about, that I've talked with my husband about, that a lot of them are very evidence-based. Because I'm a perinatal athletic therapist, I take a lot of patients through birth prep and just preparing for different possibilities in birth, educating them on the different options that they have, educating them on, you know, how to advocate for themselves, all of those kinds of things. And so I have a lot of education when it comes to the options that you have during birth, what the evidence actually shows for a lot of these options. I won't go through the evidence for each and everything that I talk about because that will make this video like 40 minutes long. But a lot of the things that I've chosen and that I would prefer to have are things that are quite evidence-based and supported through evidence. And yeah, that's really what's going on there. So if you have different opinions, if you want different things for your birth, have at her. Do what you want to do. This is what I want to do. The second thing I'll say is that none of these things are set in stone. Just because I've chosen to put them on my birth preferences list doesn't necessarily mean that they're going to happen. These are just things that I would prefer would happen given the right circumstances. I have a document that I will print out and give to each member of my birth team as well as the nurses at the hospital. It's just, these are guidelines. These are things that I would love if I had. This is if I was imagining my most perfect birth, these are the things that I would have happen. There are some absolute no's and there are some absolute yeses, and there are some like whatever needs to happen can happen. So right at the top of my birth preferences list, I have a little information section. So in this information section, I have my full name, my husband's full name, my birthday, both of our blood types, so they know. I have my midwife, her name is on there. I need to add, I have a midwife student as well, so I need to add her name on there just in case she ends up being there. And my doula, so that way they know who are these people in the room, who is a part of this birth team, and everyone's on the same page. Right on the top of my birth preferences list, I have an overall goal, and the overall goal is to decrease physical and emotional trauma for both myself, my husband, and our baby, to prevent fetal distress, and ultimately, this is the most important part, ultimately protect baby and mom at all costs. So, like I said, everything can happen, everything should happen as I would like it to, unless one of these things will be compromised. And in that situation, if measures need to be taken, measures need to be taken. So I am choosing to give birth at a hospital, And I'm doing that because for a couple reasons, actually. The first one is my husband will never step foot in the room that our child is born in if our child is born at home. We will have to move. He will remember that, he will think about that experience every single time he steps into that room, and he's had to do that at his previous dwelling, and he's not a fan. So we're gonna give birth at a hospital. Neither of us are uncomfortable with being in a hospital. I don't mind. Hospitals do not make me uncomfortable, so I'm perfectly fine with that. The other thing too, we're gonna be giving birth in Windsor. Windsor has a NICU. Being a first responder, I need to know that I am as close to help as I can possibly get if something were to not go as planned. In my personal opinion, labor and delivery can go perfectly until all of a sudden it doesn't. And I need to know that I'm in a place where help can be found if help is needed. I have been present at the most perfect, beautiful home birth. I know that it's a possibility, and I know that many people have that experience, but I also know that many people don't. So I just, for my personal comfort and my ability to relax and be comfortable, I need to be in a hospital setting. Excuse me. So in the hospital setting, I will be allowing student nurses to be present as long as they do not interfere with my birth zone. Now, I have a doula and I have a midwife, and both will be advocating for the fact that if you are a student nurse and you walk in here and you try to take control of the situation that doesn't need to be taken control of, you're gone. My birth zone needs to be protected, and if you are not willing to participate in that experience the way that I need you to, you won't be allowed to be there. But I also think that everyone needs to learn. So if a student is comfortable being there, cool with being a fly on the wall, cool with watching the way that I choose to travel through labor and experience birth, great. I would love to have you there. And of course, no visitors whatsoever aside from the people who are part of my birth team. In the hospital room, my doula has all sorts of like fairy lights and like galaxy lights and stuff like that. And so we're planning for very dim lighting. We're planning for a very calming space. I will be listening to music. I will have, I have a birth playlist that I will be listening to the whole time. So it'll be a very comfortable, environment to be a part of. And anything that interferes with that is not welcome. So then I have a couple different sections. I have a labor section, a transition section, and following delivery. So into postpartum. So in the labor section, freedom of movement, I would like to be able to move around as much as I would like to. I am planning for no epidural, unless the only reason I would want an epidural is not for pain management, but in the case that, let's say I've been laboring for 46 hours and I am absolutely exhausted and I have nothing left in me to be able to actually push and deliver this child, we can do an epidural in that case. If it's going to allow me to have a little bit of rest and, you know, get me through those last few hours after laboring for so long, we'll do it. But I don't want it for pain management. Yeah, I would like to move around as much as I would like to move around, which means I will have a saline lock. So that's the, I might be getting this terminology wrong, but essentially the IV that would be in the back of my hand, but not connected to anything. So that if all of a sudden I do happen to need it, then it's already there and they just have to hook me up, and then I will obviously not be able to leave the bed. Yeah, I would like to be able to move around as much as I'd like to. Intermittent external fetal monitoring. I don't need to be monitored 100% of the time. I think that fetal monitoring can happen intermittently and as it's needed, so then that way I can continue to move freely. I would prefer not to be induced. I would really love to do all that I can to not be induced. I'm still very much on the fence as to how long I would like to allow myself to go past my due date. I think that the due date, that's why I said it like that, is very much a guideline, and it's not actually when your baby is meant to be due. It's just the number that is calculated. I think babies will come when they need to come. However, I don't know how I feel about going to 42 weeks or something of that sort. I haven't decided yet. The risks are very minimal to wait until that 41 or 42 weeks. However, there still is a risk increase of stillborn or fetal distress. So essentially, my husband and I need to have that conversation in regards to, are these risks enough to make us need or want to go and get induced earlier? That it's whatever our preference is going to end up being and whatever we're comfortable with. So yeah, there is an increased risk, but it is so extremely small, but it's still an increased risk. Yeah, so as much as I can do to avoid any sort of induction, if I do end up getting induced, I don't even know which induction method I would prefer. They all suck. So maybe that's something we'll just cross that bridge when we come to it. I would like to have the ability to use a TENS machine for pain management. My doula will bring this along with her. Snacks and drinks as desired or needed. I think this is pretty standard now. I will be eating and I will be drinking, and there is absolutely nothing anyone can do to prevent me from doing that. When you are having a baby, you are going through the literal most athletic event of your lifetime, and if you think that it's perfectly fine to not eat or drink during it, you are fooled. It is very important to continue eating and drinking so that you have the energy to carry through. So I will be eating and drinking. We will have a whole snackle box there ready for us to take snacks and eat whatever we need as time goes. But yeah, ain't nobody gonna be stopping me from eating. If I do request any sort of pain management, it will be morphine. There is no risk to the fetus with utilizing morphine. It's literally just a pain management measure. That it doesn't stop you from being able to feel everything. It literally just masks some of the pain. So morphine only for pain management if absolutely needed. Very few cervical checks. Midwives do this anyways. Just decreases the risk of infection if you have fewer cervical checks. So I would prefer as few as needed, or as few as possible. And also, like, cervical checks do not tell you how progressed you are, or at least cervical dilation doesn't. So I don't need to be checked every hour so that they can tell me I haven't progressed, because labor is constantly progressing. That's what labor does. And so I don't need to be checked, you know, after an hour for someone to say, oh, you're only at 4 centimeters. There are many different ways that we can measure progress during labor. So if I do end up having cervical checks, I also want to know what is the softness of the cervix, what is my effacement like, all of those kinds of things. I don't care about dilation nearly as much. No manual water breaking. It's not necessary. It really isn't necessary. It just doesn't need to happen. So we won't be doing that. Nitrous oxide is something that we talked about with my doula. I have had laughing gas in the past and it has made me extremely nauseous. So I never even really considered it, but she did say, you know, the nausea is really common, but it can still allow you to just like push through contractions and stuff. So I have it as an option on here. The other thing that the nitrous oxide does, if you are utilizing it, you have to stay on the bed. I feel like that would be something that I might want to utilize much later into labor, when I'm kind of ready to just not be moving and, you know, spend more time in the bed, or even right at the beginning when I'm just trying to rest a little bit more. So yeah, that's something that I need to consider as well. Okay, and then we get into sort of the transition and the pushing phase. These are all things that are as long as fetal distress is not present, okay? That's the important thing to note here. So delayed pushing, if there's no risk or signs of hemorrhage or fetal distress, essentially what this means is just because I get to 10 centimeters doesn't mean that it's time to push. my body will begin to push when it's ready to, which is also the fetal ejection method. So I would like, or fetal ejection reflex, I would like that to be allowed as much as possible, which also means I don't want to be coached through pushing. No one will be telling me push and hold and push as hard as you can for count of 10 or whatever the case is. I would like to be allowed to push as I feel that I need to. Obviously with some coaching if I need that, but not in the case of, okay, now it's time for you to push. No. I will tell you when it's time for me to push. So along with the pushing, I would like for spontaneous pushing in flexible sacral positions, which means on hands and knees, side lying, in a lunging position, in a squatting position, in a standing position, whatever I feel the most comfortable with, even if I choose to be on my back, whatever. This is a conversation I had with my midwife very early on when I chose to be with the midwives. Is it's important to me to know that I have control over the position I would like to push in. So when I first met with her, I asked her, if I have an epidural, will I be allowed to push in a different position than on my back? And she said, absolutely, we will get you into a position that you're comfortable in. So, or that I would like to be in. So that's very important to me, to just know that I have the option. If I choose to deliver on my back and that's just what I want, then great, then we'll do that. But if I'm uncomfortable on my back and I want to be on my side, or I want to be on all fours, it's important to me to know that I have that option. So if you are debating pushing in a different position, just talk to your practitioner about it. Most of them are pretty open to different positions, as long as you have someone to support you in those positions. Yes, it's less convenient for them, but that doesn't really matter. They're not the one pushing a baby out. We will be avoiding an episiotomy and forceps at all costs. However, if either of those are needed, we better have a pretty good conversation as to why, what the risks are, what the alternatives are. I don't know if you ever heard the acronym BRAIN. It's a really common birth acronym. I'll just put it here for you. We better be having a pretty good conversation as to why those measures are needed to be taken. There's actually very little evidence that supports episiotomies. I would like to allow for natural tearing. Natural tearing allows for a more natural recovery, so I would much prefer to do that. There's something called expectant management, which means when I have delivered the baby and we're still waiting for the placenta to be delivered, I would not like anyone to deliver my placenta for me. I would like to allow for a physiological placental delivery, and of course delayed clamping until the cord is either white or until the placenta has been delivered. Now, again, that's if everything's going perfectly, if I'm not hemorrhaging or anything like that. If I am hemorrhaging, please get my placenta out of me. However you need to do it. But I would like to avoid that as much as possible, obviously. Warm compresses and perineal massage to prevent tearing. This is something pretty standard that most midwives do anyways, but I just included it in there. And no time limit for pushing unless there's a risk present. So if, let's say I'm pushing and I've been pushing for 20 minutes, half an hour, whatever the case is, as long as there's no fetal distress, we're just going to keep going. We're just going to do it as we're doing it, and that's the way that's going to be. Then following delivery, immediate skin to skin, which again, super standard. No bath right away, which is, I actually found out very recently, is pretty standard for hospitals now to not do a bath right away. And very light rubbing of excess mucus, blood, whatever the case is. There's no need to actually wipe or wash the vernix off of the baby. That's that like thick, like mucusy stuff. No reason to wash that off right away, so I would like to avoid that. If I cannot hold the baby, then my husband will be holding the baby, just depending on what the situation is, whether I'm super shaky or kind of out of it or whatever the case is. My husband will be holding him. If the baby is not doing well, if there is a need for the baby to go to the NICU, my husband will accompany him and be with him the entire time while I am being cared for. I think that's also standard, but he needs to be able to follow the baby and be with the baby. I would like a breastfeeding attempt to happen as soon as possible. If I'm unable to do that, then we will provide colostrum, which I'm hoping to do beforehand and then just bring with me. For our baby, yes, we will be getting a vitamin K shot. That's the only thing that's standard currently. According to my midwife anyways. I think different practitioners are obviously different, but she said, yeah, the vitamin K is really the only one that we would do right away anyways. I'm negative for any type of STDs or anything like that, so there's no need for any other measures to be taken there. A parent must be present for all exams, which kind of goes along with if the baby goes to the NICU, then my husband would go with him, but there has to be a parent there all the time, which again, pretty standard. Our baby will stay in the room with us. Where I live, this is standard. Like, unless the baby's in the NICU for whatever reason, the baby will stay with us. And then we've also included circumcision or no circumcision on this list. I just won't even go into that. Whatever your opinions are on it, great. We have made our choice. It doesn't really matter what anyone else thinks in regards to that. And then I have just a couple notes on the bottom that says, this is my first delivery. I have no pre-existing conditions, no risk factors, and no allergies. So I'm actually going to put that on top. So that way they know when I get there that there's not really anything, no risk factors that they need to be aware of and that they need to be concerned of and checking me for. I can just go about my delivery as planned, hopefully. So it's pretty in-depth. I have really included a lot on there. I've gone through it with my doula. I haven't gone through the whole thing with my midwife yet, but we've gone through bits and pieces of it, and she's okay with a lot of the things that I've put on there. But it's important to me, so my doula knows and my husband knows, it's important to me to have people who can advocate for me if I'm unable to advocate for myself. And so that's one of the biggest reasons that we have a doula, is so that she can be an advocate because she understands the birth process and the labor process. And the other reason we have a doula is because my husband is just not a medical person, and I just have a feeling he won't be on 2 feet the whole time. Like, I just have a feeling that there will be some parts that he just is really struggling to handle. And so I need him to know that he's not the only one there that can care for me, because I think that would make it even harder for him. And the reason that we went with midwife over OB is because midwives allow for a little bit more of a physiological birth, and they allow the birther to do a lot more of the work and to have more autonomy. In a lot of situations, at least where I live, OBs tend to run the show a lot more versus creating sort of a team environment of, this is what we think should happen. This is, why don't we do that? We're going to do this together sort of thing. OBs tend to just take over a lot more. Not saying that there's anything wrong with going with an OB. What you have to do, whatever it is that you're comfortable with. So if you are comfortable with that and you're like, I don't care what happens, I just want to get this baby out and eat some sushi after, you do you. Whatever is going to make you more comfortable, that's what you have to do. So that's my birth preferences. There's a lot there. There's a lot included there. But again, I understand the full process. I understand every stage of labor. I understand what happens in each stage. I know what fetal positioning looks like. I know all of these things because I've been trained to. And so I have a little bit more understanding when it comes to what choices I should make. So if you don't have the same sort of education behind it, it's going to be yours is going to look very different, and that's perfectly fine. If you just Google like birth plan, there's a bunch that come up, and you can kind of choose based off of which ones vibe the best with you and which ones make you feel the most comfortable. And you have to essentially decide what sort of measures are you willing to have taken, and what are your goals, and kind of build your birth preferences from there. Well, anyways, thanks for joining me in this cozy little car chat. Again, sorry about my voice. I'm definitely losing it a little bit more after talking for so long. But yeah, if you guys have any questions about my birth preferences, if you want the evidence behind some of the things I talked about, please ask for it. I am absolutely willing to send you the articles that some of these things come from. I think it's very important to be informed and to make sure that you can make an informed decision as to what you want. And so if I can help you guys do that and support you with providing you with some evidence, then I would absolutely love to do that. So please, 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 if you have questions or there's things that you would like to explore further, please ask, and I will share that information with you. Well, anyways, thanks again for joining me. I hope you guys have a lovely day, and I'll talk to you guys soon.